Decoded, The Future of Health, hosted by Dr. Vinod Gauba and Alex Kummerman. Today's special guest is Nicole Sirotin, CEO of the Institute of Healthier Living in Abu Dhabi, discussing getting to the root causes of health issues earlier.
It's with great pleasure that we have Dr. Nicole Sirotin with us today, who's the CEO of the Institute of Healthier Living in Abu Dhabi and former department chair of Preventative Medicine in the Cleveland Clinic, Abu Dhabi, and a world-recognized pioneer in the domain of lifestyle medicine, precision prevention, and chronic disease management. Thank you so much for being with us today.
Thank you. I'm delighted to be here. Thank you so much.
So, Doctor, obviously you've had a very rich history of accomplishments and really leadership roles that drive this domain. Can you give us a bit of an insight into what's your passion that brought you here, that gets you to wake up in the morning and have the zest to go through the day?
Thank you. I think the exercise I do in the morning actually gets me the energy, but the story is deeper than that, of course. Mm-hmm. So I find that the most inspiring part of being a doctor is the relationships you make with the patients. And I have a very special patient who actually helped us form the Institute for Healthier Living Abu Dhabi. And he walked into my office in 2016. So this is coming from the US. We started the Cleveland Clinic Abu Dhabi with great hopes and really have achieved a lot of what we set out to do, which was to think about complex care in a different way. Now, I have loved the idea of empowerment and how you can help patients really treat themselves as we're also treating them with medical advancements. But this patient came into my office in 2016 and he said, "Doctor, I don't think I need these medications anymore." So this is a 50-year-old Emirati man. This was not my normal visit in the primary care department at Cleveland Clinic, Abu Dhabi. And so he and I started, of course, a series of testing. We realized he didn't need it. And what he did was he read an influential book called The China Study, which really laid out diet interventions and what they could do for your health. He started exercising again, and he really didn't need these meds. And so we ended up spending years, right? This is 2016, in our normal 3 to 6 month visit, not having much to talk about, except you're doing great, keep doing it. And so we ended up having very interesting conversations around Abu Dhabi, around chronic disease, around lifestyle, the impact of lifestyle, what we could do on the system level. So fast forward many years later, we said, okay, maybe we should actually really do this. And so we started to think about the Institute for Healthier Living at that time as a concept of how do we help the system really address these issues at the root cause and not replicate the system, not try to recreate the health system, but solve some of those complex problems and hand it back into the system. So he is now a board member of Institute for Healthier Living Abu Dhabi, and he continues to be a great supporter. But I think that time you get with patients where you actually see them change and absolutely transform their lives, both from their energy level, from the way that they can meet their goals, whatever their goals might be. And also what you know is coming later from the medical perspective is less disease and less burden, right? And so the patients continue to inspire me. Yeah.
And I have to say, even that root cause analysis and kind of getting to the root source of the problem is kind of how I've always practiced as well. And hence the transition from this kind of sick care model that we've got used to, to this truly healthcare model where, prevention becomes center stage rather than an afterthought.
Yeah. And I think we have lifestyle recommendations in almost every guideline that exists, right? They're just not done, right? And I think this is part of the challenge, right? We don't have a workforce that's trained. It's not reimbursed. The whole system is set up for that not to work, right? And so until we have the incentives aligned in the right way, it will continue to not work. It's still a great system when you're sick. We can still take care of people when they have cancer, when they need surgery, when they need medication. It works in that way, right? But when you're really thinking about actually helping people live healthier lives, it's not working. We know that, right?
Cue the institute.
Yes, cue the institute. Yes.
Beautiful. And so in your institute and your story, thank you for sharing it. It looks like, the human is the central part, of course, but how do you see technology? How do you embrace the help and the support from new technology, especially AI, in your institute?
Yeah. Thank you for that question. We have to have technology. We need it. And actually, what's happening now in the health system is that we're a bit stuck, right? Because again, the incentives are not aligned. We have a way that you come in, you get diagnosed, we code, the insurance pays the hospital, and this system continues. And then we have a lot of really exciting innovation happening in the commercial space and in the private space, where actually we can diagnose better, we have early detection, we can think about risk stratification better, all using AI tools, but none of that has made it into the health system. So we have this death valley in between these two. So part of what we're trying to do with the Institute is think about what are ways in which we can incorporate that technology in cost-effective and, of course, clinically effective methods so that we can understand what are all those biomarkers we can measure, understand all that information about you as a human, including your genetics, of course, and your biology, but also your environment, your lifestyle, your choices, your preferences, what you've been exposed to, and actually take that into a risk prediction tool because you are more than just your biology, right? You interact with the environment every day, and we have to understand that aspect as well. So we are incorporating AI to help make sense of all those data points. We don't have traditional tools to use it. This is a great place for AI. It also helps us understand that risk prediction modeling. So how can we do that on a population level to really understand a group of people's risk so we can highlight those high risk individuals and then reroute them before they end up getting sick.
And can you dive a bit deeper into how do you do that now, today, and what's the future? Where's the limit between how you're implementing this strategy or this intent into actionable insights today, and who are they intended to be read by?
Yes.
And what's for the future?
It's a great question. The actionable items today, I think, are actually more than we're aware of. Again, because we don't have this implemented within the health system at this point. But we have abilities to do individual risk stratification today on a much more sophisticated level than we would in a traditional healthcare system. Even 2 members of our research team published looking at data just from the health records at Cleveland Clinic Abu Dhabi. So they just looked at records, anonymized data from the health system. And what they could see is actually applying their risk stratification algorithms, they could identify people who would have a heart attack, stroke, or develop blindness from diabetes at better than standard of care, right? So earlier than the health system had identified them. So even right now, we can do that. We can do that on a large anonymized data set. The challenge, I think, is how do we then re-anonymize that, take that individual out of that system and say, okay, we've recognized you're at high risk. Why is that? Because we can see these markers in your system, and then really put people through programs that will help change their lifestyle, that will really focus on that root cause. And so I think the future is where this happens on a population level, right? And it really happens in conjunction with the public health system because we have a system. We don't need to recreate it. We just have to utilize it in a different way.
And I think that is a perfect entry into our little debate we had earlier as well, which was about effectively who should be delivering that and how is that, what's the point of access?
Yeah.
And I think given the scope and the scale, when you start talking about population level, the question is, we have to empower existing soldiers in the troops effectively. And who are those soldiers and how should they be empowered?
Yeah, it's a great point. Part of what we can do is upskill current healthcare workers, right? And I think the UAE has really demonstrated this quite effectively during COVID. So, of course, all of the healthcare system was really mobilized during COVID. And we had mandatory modules that we all had to do that actually took us through the way in which we approach a COVID patient. So even the eye doctors, right, were learning about managing sick COVID patients because that's what it took, right? And so I think the ability to upskill is here with us. What we have to agree upon as a field is, what are we training people on? Right. And right now we have very, very actionable ways to help change people's lifestyle that we know are associated with longevity and health span benefits that are just not implemented. So the UAE has, we've just had our inaugural meeting actually of the Emirates Lifestyle and Longevity Medical Association. So that's one step. We're able to really think about how do we pull in more physicians to get trained in lifestyle medicine, and we'll be able to implement that exam and that CME training. But then you have to think about what's next after lifestyle. And this is where the longevity field, I think, needs to organize ourselves a little bit more, right? We have the Healthy Longevity Medicine Society, which I'm a council member of, and our goal is really to help think through that accreditation process. How do we make sure doctors are trained, and there is some third party that comes in to say that doctor is trained to do this kind of medicine, right? Because that's what we do with medical school, that's what we do with residency training, and we need something equivalent within longevity. There's a lot of interest, there's a lot of money, and there's a lot of commercial desire here, which on the one hand helps push our innovation, and on the other hand actually puts patients at risk, right? And I think we have to balance this as we're developing. I will tell you a story about my own experience. I went in as a patient, so I've been exploring different longevity clinics. I'm always very open. I'm a physician. I'm in this space. I think that's the right thing to do when I come in as a patient. And so I was going through a clinic and they took my ECG, and I have a known normal variant on my electrocardiogram. And the nurse took one, and then she took the second and the third. And by the fourth ECG, I was realizing, okay, we're gonna have a conversation soon. So then the doctor comes in and he says, I think you need to go to the emergency room, right? And I said, okay. I'm an internal medicine physician. I'm happy to go through the ECG with you. I know I have a known variant. Here's my cardiology friend. We agreed I don't need to go to the emergency room. We went to the end of the visit. And then I realized that I didn't actually know what kind of doctor this person was. And so I asked him, and he said, oh, well, I'm a urologist. And I said, okay, then it makes sense to me. Urologists genuinely have a role within longevity medicine, but it's probably not reading my ECG. And so I think this experience that I went through actually really helped me crystallize the thought around what is a longevity doctor, right? Who is qualified to do this? We're talking about medicine that keeps you healthy. So you really have to understand the whole system of what that means to keep you healthy. It's brain health, it's cardiometabolic health, it's musculoskeletal, it's gut health. And so if there are physicians or practitioners that can do part of that, like a urologist can absolutely manage hormones and think about men's health in a different way, and women's health for that matter, right? As it pertains to the urologic system. There's a role, but to take on all of the scope would be questionable in my mind. So I think the key is we need standards. We need to have some sort of certification process that the world agrees, just like you're a cardiologist, because there is an association that has designated you to have enough training to pass the exams, to go through the fellowship training to be a cardiologist, then you can be a cardiologist, right? So I don't think we would want anything less for our family members or ourselves as we're going through medicine. The other space is the commercial space. So what can we do to get more of this out to people that isn't practicing medicine? And that's also an interesting conversation.
And do you feel like, given the scope and scale of what needs to be achieved, we're trying to effectively revolutionize the current way of practicing medicine, but even down to the individual level of implementing lifestyle decisions. So we get the genomics, we get the epigenomics, we get their transcriptomics, we know their blood biomarkers, their gut, so forth. But then it comes down to people making individual choices and decisions on a daily basis. And so do you see a role for a human tech interface there? Maybe a role such as a longevity coach. And then using a tech-enabled platform that can actually then allow them to make those daily dynamic decisions that align with the North Star.
Yeah. Yeah, absolutely. I think we need both. I mean, we need the healthcare system to be different in the sense of applying things that we know already work, right? So everyone should have cancer screening. Everyone should have cardiovascular risk stratification. Our current healthcare system could do that if they chose to, right? Then we have longevity medicine as a field. So how will we take the science of longevity and actually practice medicine to be able to say, I have your health in my hands and I'm going to keep you healthy, and these are all the ways in which I'm going to do that. Then we have what happens in a day-to-day basis, as you're saying. And this, I think, is a very exciting commercial space. That's not practicing medicine, right? It's helping people understand themselves and what their risk is, and helping them make behavior change that will help mitigate that risk. So we can do that in a clinical setting, but there's a lot of ways you can do that in the commercial space, which is exciting. And that isn't medicine, right? That is actually just helping people live healthier lives as they make those daily changes, right? So I think there's room for everyone. What I'm concerned about is those lines right now are blurred. Yeah. And so we have companies that are developing a technology. They're selling that to clinics. The clinics want to buy that because it helps bring in patients, right? And so, but no one's stopping to question, is that actually proven to work? Is that safe in patients? And has it been put through the rigor of a clinical trial in the same way that we would, let's say, prescribe medication, right? And so there's a lot of active debate around this process, which is exciting. This is the new field. Yeah. But I do think there's space, and I do think there's actually a responsibility to get this into as many hands as possible, right? Because the healthcare system alone, even when we look at what impacts someone's current health status, right? The healthcare system is about 10% of that equation, right? As much as we want to take credit for lots of impact on people, right? It's lifestyle and environment, right? That's 75% of that, what determines your health right now.
Yeah. And I suppose it's the nexus, as you said, between this kind of accountability partner, guide, coach, empowered by technology, and then the longevity medicine world and your healthcare physician community.
Yes.
And that interaction needs to work out better, as we saw in your example with the urologist, where if that interaction was more fluid and more well established, that would be an immediate phone call to the colleague, right?
Yes.
Rather than trying to take a call themselves.
Exactly. And I think there's, as I said, there's a role for different kinds of providers. There's roles for different specialties. There's even roles to remove the physician completely, right? And to really have a lifestyle coach that's trained as a health coach that has the ability to help people move through behavior change. That's its own science, right?
Correct.
And most physicians are not very good at that, right? It's here's your recommendation, I'll see you in 3 months, right? So we wouldn't put a big project in the hands of someone who's going to tell you, okay, I need you to build this building and I'll see you in 3 months. No, you have a project manager, you take it through a clear timeline, you have your dependencies, right? So this is how we need to approach our health if we're going to make those big changes. Right?
And it's the challenge of chair time again, isn't it? And how much time a physician can actually spend hand-holding someone through that lifestyle modification.
Yeah, and nobody pays them to do that, right? No. So I think, again, the incentives are not aligned. What we have the opportunity to do here, which I think is really exciting, is that we can think about this in the sense of a closed system. So some of the other parts of the world where you have the private insurance or you have employer-based insurance, they don't have the same incentive actually to keep people healthy, right? And so the beauty of what the UAE can do is that there is a bit of a closed system. So we can really help push forward concepts that help keep people healthy and will help save the government money.
Oh, wow. And so in this blurred line problem or confrontation, and what's being done today in the medical space, how can you help us to paint kind of your view of the future of the hospital? What is it that will become the future of the hospital here?
So hospitals play a really important role, right? People will get cancer. They will need surgery. We need excellent subspecialists to be able to take care of rare conditions. And we need the ability for us to, I think, take someone from the time they're sick to cure, right? That's a need. What I do think will happen is that we will have a more decentralized process for understanding risk and helping to keep people out of the hospital. So there will be less of a need in the hospital for the traditional kind of risk mitigation strategies that we put in place, right? Cardiologists will be dealing with people who have heart disease already, right? Then the preventive cardiologists will be thinking about how do we help prevent those cases. And once we can align the incentives with being able to pay physicians and pay for medications for prevention purposes or for, let's say, reversing the aging process, because if we reverse the aging process or even slow it down, we know that we will get less age-related diseases, cardiovascular disease, dementia, being two of the largest ones. And so I think there will be a decentralization that happens, but the key to that is where is the incentive, right? Because the healthcare system as it currently stands can't support that, right? And so we have to be able to think about the blueprint where there is someone else who's paying for that. And that's really the question. Who is going to pay for it to keep people healthy, right? And again, I bring the UAE up as a great example because we can do that here in a way that I think can help show the rest of the world that it's possible. We have a blueprint. And then health systems can adopt it based on their resource level. And if we bring in the technology, we make that scalable. And so you can have a little slide rule that says, okay, we have less resources, so this is a technology solution that can still work. And we have more resources. We can go more into, let's say, even prescribing medications or putting people through, more expensive testing to help understand their risk. So I do think that the reason we've really focused at the Institute to work closely with the government to help set up the regulations is because if we get those incentives right from the beginning, then we have a much better chance of success here. Without it, we're looking at people who can pay for something can get it, people who can't pay for it won't get it, and we fragment the progress.
And just a little shift of gears here. Being in the space of preventative health in general, the end point is not having a disease. It's a negative end point in the sense that N0, it doesn't happen. So how do you keep that engaging and attractive and sexy enough for an end user to say, okay, I've done all this and I don't have the disease? Like, how can you keep them motivated year 1, year 2, year 3, year 10, year 12, year 28, year 50, year 100 at this point, So how do you see that problem and how can we work with it?
It's a really good question. This is all psychological, right? So we have to think about a few things. One is, how do we measure success, right? So people like numbers, right? They like to come in and look at their cholesterol and how it compared to last time, right? We like to measure ourselves against things. So one of the main goals of the field is to really come to consensus on what are those biomarkers of aging. So how can we really tell you with good amount of certainty that your aging process is slowing? I think once we have that, and we are getting there, once we have that, even to the level of the organ, we can tell you your heart is aging slower than your brain or than your liver. Let's focus our lifestyle and our interventions on those organ systems that maybe need a little bit more, whether that's because currently you have a lifestyle that's affecting those, or you have a genetic predisposition in that specific organ that's affecting you. I think that people also need to feel better, right? So genuinely, they need to feel better from what we do. And no one really feels different when they take their statin, right? Yeah. The reason medication compliance is so terrible for most people is because they just don't feel any different, right? And we call, right, I mean, high blood pressure is the silent killer, right? Why? Because no one really feels that. So we do have to make people feel better. And I think this is where the comprehensive lifestyle changes can do that. If you get someone who doesn't sleep well sleeping well, they think you're magic, right? Yes. This is miraculous, right? Yeah. So we have to get people to feel better. And I think if we can do those two things, you get people feeling better. You also actually have some level of measurement where they can see that their progress is in a number of some form, right? Or at least in multiple numbers. Then with those two things, we can keep people engaged.
And it's fascinating, isn't it? Because it is so much human psychology than it is even medicine. Would you say that it's a dynamic process of reprioritization, looking at very diverse data sources to simplify it, and trying to constantly readapt the area of focus? So it is an ongoing, continuously dynamic journey. We all know we got to sleep well, eat well, move. We know the fundamentals. We've been hearing it from our parents and our grandparents. But the reality is that it's a very personalized and very dynamic process, if I understand correctly.
Yeah, absolutely. I think, and it really depends on how that person lives their life, right? And so with many of my patients, we get very granular because if you don't, you never get to what is motivating them. And you have to be able to match what motivates them to what you want as a physician, right? Because, okay, I might want to lower their cholesterol, but what they really want to do is play with their grandkids, or they want to be better at work, or they want to focus better, have better relationships, right? And so really matching those to their goals is the only way that we can move forward. And some people need more help than others. I've had patients send me their lunch menu and say, Dr. Nicole, what do I pick? Right? To that level. Yeah. Very important, very, very successful business people, right? And I think that's because there really is a need for some structure in the recommendations. And there is varying levels of understanding of when a doctor says eat more fiber, what does that mean, right? How do I eat more fiber? What has more fiber? Give me some details around it. And partly what we have to do is really make things easy for people, right? Within the construct of their life. I mean, I've had many attempts to make behavior change myself, right? We all have to evolve and continue to improve. And it's hard sometimes, right? So I also think we need to not over-optimize, right? And I feel like this is where people get a little bit frustrated. Yeah. And I'm sure you've experienced this, where people have, they want to try to do it all, and they think there's like a perfect, right? So maybe also having a little bit of understanding that this is really just a process, right?
But in this perspective, you mentioned the importance of measuring and, maybe giving this notion of time, including this notion of biological time that has different dynamics. How do you think we are perceiving those the complexity of those different notions of time? What is it that you've experienced with your patients? How easy is it to understand? Because it's quite a complex topic.
It is complex, and it's also, again, gets back to what people really care about, right? Because when you think about time, what do we want more time to do? We all will die. We understand that, right? We don't have control over that.
No.
But we do have control over how we live, what choices we make, how rich that life is. And so we can think about that in the choices we make in our partner or the choices we make in our job. And to me, it's the same concept of the choices we make in our health, right? You have a choice. You choose to get 10 minutes of intervals in on a busy morning when you're driving to Dubai, right? Yeah. Just to have enough energy to get through the day, right? Or you choose to not do that, right? And so I think also empowering people with that choice, right? They really do have the ability to move their own needle in so many ways. They have to understand what that looks like. And even just explaining to them that there was a study, 10 minutes of intervals over 3 months' time versus 45 minutes of doing a steady state cycling had the same impact on VO2 max, right, in middle-aged men. So that's a really powerful study. So I can with confidence tell people that 10 minutes of intervals is really going to help you in the end, right? And it's only 10 minutes, right? So finding ways to use the data, help people understand, empower them. Then when you're talking about time and you're talking about how long do you want to be vital, right? How long do you want to have this healthy, vital life where you can think and do things and interact and have fun and work and play, right? Then I feel like people can grasp it more, right?
Yeah, but it's flying away.
It is flying away, and this is it. It's limited, right? So people have to feel that, right? And they have to feel it without panic, right? They have to feel like, oh wow, but there's so much I can do. And this comes back to your question about how do you keep people motivated. In my experience, you have to help them feel better. They have to feel that they can function better. Right. And once you get people functioning better, then they want a little bit more of it and they want a little bit more of it. Right. And so I think that this is just human nature. We like what's good. If it's working, we keep going. Right. And so, and of course there's ups and downs, and we have to also help people, again, just not feel like there is no end to this. Right. We just keep going. Right. And so that liberates us a little bit from feeling like it has to be a race. Right. And that we have to do it all at once, and we're failing if we don't, get in our 25 minutes of meditation and our 10 minutes of intervals and our diet changes all in the same time.
Yeah, and it's not making people feel that whole sort of you're not good enough yet. And you keep having to improve. You keep having to improve. You keep having to. At a certain point, you're like, look, I'm good as I am. I understand my body. I feel great. Your data might not always match it, but sometimes data lags, and it might actually show up further down the line.
Absolutely.
And I think it's using that. Eventually, it all comes down to daily decision making, right? And empowering the individual to make the right decisions, using the research, using the data, aggregating all that information to help them and empower them.
Even there's an interesting study out of Walter Longo's group from USC looking at the fast mimicking diet, right? So this is a 5-day program that people do, low calorie, low protein diet. They've studied it in many different disease states, including fatty liver, obesity, diabetes. And actually, it just got approved in the U.S. for insurance coverage for diabetics because they've shown that it can lower A1C. And this is episodic, changing your diet for 5 days, right? So that's powerful. And I think one of the most powerful things in his research is actually what he showed is exactly what you're saying. There is a lag a bit in as far as you get an immediate benefit, of course, while you're on the program, but there is a lasting effect that happens in the body from those changes that you make, or from the 5 days change. So not only do we find that people change their behavior, actually there was an interesting study on dry January, right? So obviously dry January is this popular concept, but they actually did a study looking at what happened 6 months later, right? And people who participated in dry January drank less 6 months later, right, than they had originally reported. So there is also value in just time, right?
Yeah.
Because there's processes in the body that continue. So the effect on IGF-1 as you're fasting can continue even when you stop fasting. This behavioral change that you make maybe in an aggressive way as part of this big month where there's, no alcohol, they've really shown that actually people do drink less later, right? Have less problematic drinking. So I think that every little bit counts, and part of the goal is to help people just enjoy it, right? So that they don't feel like this is work, that they have to wake up and do all these things, but actually there's ways to move, there's ways to eat that are very pleasurable, right? We have to bring the joy factor in, because what are we living for, right?
Absolutely.
We need joy, right?
Exactly, and adding life to those years, right? And sometimes people see, with all due respect, Brian Johnson and the likes, taking sometimes that to the other end of the spectrum, where the living is kind of being replaced by the not wanting to die.
Yes,
and I think
it's
that's
really
an important conversation.
It is.
Yeah, it's a really good way of putting it. And I think we there's a spectrum for everyone, right? And this is where the personalized thing comes in. I've had patients react negatively to their CGM because then they restrict themselves so much, right? Because there's a spike on my CGM. And I said, well, listen, that's your body. That's going to happen. As far as it comes down, how fast it comes down, this is what we're watching for. And also you must enjoy, right? There must be joy. So let's find foods that don't increase your blood sugar, of course, but there's ways in which if you can match the joy inside what you're doing, people will continue to do it, right? They feel good, they're enjoying, they'll keep going, right?
Yeah. And actually, on that note, could I push you to give a key points that you would suggest in your experience that have a dramatic influence on lifestyle that people listening to this can go away and try to implement? I understand it's very personalized, but from your experience.
Yeah, I think it's always like, which is your favorite child, right? Because they're all important, right? Of course, nutrition, exercise, sleep, stress reduction. I think the one that is most neglected is sleep, though, honestly. And I think we don't approach it from a medical perspective. This is not something that's really, except for sleep apnea, which is a diagnosis that you get a treatment for, it's not something that we discuss. We know the importance of sleep, and not just sleep, but rest. So actual rest time where our bodies have a completely different purpose. That is the time that we're actually regenerating, right? That's the time that we have new processes forming, right? So I think that my focus is, of course, we have to do the simple things well. We need to cut out ultra processed food. We need to actually make sure we're getting enough fiber, take care of all of those bacteria that are loving us in our gut, right? And we have to exercise. Of all of the lifestyle factors that have the impact on longevity, right? Exercise is really the number one that's been studied to show that we can actually extend life with exercise, right? And so I can't neglect the exercise, right? And I think really looking at VO2 max as a marker of longevity is the way we should all be thinking. We also know that when we improve VO2 max, we actually can directly decrease healthcare expenditures, right? So it has a direct impact on how much money you might be spending. And it does make people feel better, right? So really thinking about, again, interval training, adding in strength training to make sure that we're rounding out our exercise plan. And then sleep, taking it seriously, not just that you're in bed for 7 hours or 8 hours, but actually adding that little buffer time where you're winding down, right? And then having that time in the morning without devices, right? Where you're actually allowing yourself to come back into the world in a calm way, right? And I think implementing those very small, even 10 minutes before you sleep and 10 minutes after you wake, right? So that's 20 minutes out of your day of wind down time and gearing up time. That's really kind of purposeful, can make a difference. So if I had my very short list, maybe not one, but 3, right? It would be definitely adding more rest and sleep and putting in those 10-minute buffers. adding strength training, because most people are not actually lifting weights. It doesn't take much. I've never been a gym rat, but I really have gotten to love strength training because of the way it makes me feel, right? And then thinking about your diet as food as medicine, right? Your food is absolutely feeding all the different parts of your body. So thinking about the quality of the nutrients and the quality of the food as it pertains to your health, right? So really putting the quality bar high then cuts out a lot of food that isn't good for you, right? So if I eat a steak, it will be very, very good and very infrequently. If I eat something that is, let's say, what can I pick that I won't offend anyone, right? An unhealthy food that's very delicious, right? I will eat it with very good ingredients and again, infrequently. And I will make sure that it's enjoyable, right? Because if it's not enjoyable, then
don't have it.
Don't have it. And this is when it's really helpful to also have the habit of fasting, because if I don't have food available, that's not what I want to eat. I just fast for a couple hours and I'm fine. Right. So that's not a short answer of one thing, fantastic. But I think it's a way to think about
very,
it.
very useful takeaways and insights there. And I think plenty for people to take away and understand that it is all down to the daily decisions that you make and making those decisions wisely and well-informed. On that note, thank you so much. We really appreciate your insights and thank you for your time.
Thank you so much.
Thank you very much.
Enjoyed talking to you.
Pleasure.
Great.
Thank you.
Take care.